Welcome to Adapt NCLEX. This is a video regarding pediatric health assessment. Key concept. I'm using the concept to make questions for you to prepare for your NCLEX. High yield facts. Let's get to it. Now, question 1. What am I trying to ask you to do? Which vocalization, keywords, buzzwords, the next you expect? A 4-month-old is in the ped clinic for what? A well baby exams. Which of these vocalization you should expect? Age is always a factor. Pay attention to that. You see a bye-bye, imitate sound, laughed out loud, or say dada? What do you think? Keywords. Okay, there's certain landmark vocalization you're supposed to know. 2-month-old, what did they do? They cruise, right? 4-month-old, what did they do? Laughed out loud. 6-month-old, they imitate sounds. 8-month-old, what do you think? They say daddy. 10-month-old, they say bye-bye. And 12-month-old, they imitate animals. These are landmark sound vocalization you should know. A 4-month-old, loud. They laugh out loud. So that's the key aspect of the question. Like I said, key concept, know this to be able to answer this question. Straightforward, nothing to it. Number 2, let's get to it. Which of the following action is a priority? You have to be sharp. Prioritization. A nurse is caring for what? 9-year-old client who is receiving what? Chemotherapy, keyword, infusion for acute myelogenous leukemia. Guess what? Buzzword, 9-year-old who has leukemia is getting chemo infusion. What is your priority? You have to be sharp. What I mean, what is going to kill this patient? Administer oral rehydration, assess for infection, monitor for wheezing and urticaria, and minimize for activity. Minimize activity. What do you think is the most prioritized? Examiners know that you can be trapped. I know this patient has leukemia. Of course, I'm going to worry about infection. He has leukemia. He's going to get tired, fatigue. I'm worried about it. He has leukemia. We need to let him get hydrated. This is due to weakness and anemia. This is due to immunocompromised state. But guess what? I said the client is getting what? Infusion. Right now, when you're getting infusion, when you're getting infused with chemo drugs can cause anaphylactic reaction. They're very dangerous. So when patient is getting chemo right now and you're watching them, monitor for signs of anaphylaxis, wheezing, and urticaria. Rehydration is post-chemotherapy. Assessing for infection is after they receive the infusion. And let them minimize the activity is after they receive the infusion. Prioritization, monitor for something that will kill them, and that is anaphylactic shock. Wheezing and urticaria is your right answer. Number 3, what do we have? A nurse is caring for what? A 3-hour newborn with what? Myelomeningocele. Which of the following action is a priority? The same thing, prioritization. We have a patient who has myelomeningocele. What this means is it's a form of Spina bifida, but this involves what? A cystic fluid, 1, the meninges, 2, and then the nerves are involved. So 3 segments. Because of that, for patients who have this kind of problem, worry about neurological issue and they are respiratory because they can develop hydrocephalus, they can have seizures. So whenever they're born, monitor for neurological issue and seizures. Because of the cystic structure and the nerve and the neural tube that is involved, you don't want to put them in the supine, the best position in the prone position. Of course, I'm going to ensure adequate fluid and monitor for the temperature. But the 2 things I told you, respiratory and neurological problem is the biggest in this patient. So assess, monitor for their respiration. Number 4. Which of the following action, once again, action is expected? And this is in a code for a 3-month-old. Another nurse joined the code. Which of the following action is expected? That means you're doing a CPR on a what? 3-month-old. And another nurse shows up. What do you do? Keyword, key fact, concept, compression rate never change. For a kid, 1 rescuer is 15 to 20, 2 rescuer, 15 to 20. Another nurse coming should not bump this to 30 to 2. This is for adults. Compression rate is always 100 to 200. The depth, this is too deep. It's 1, 144, 1.5. And the breaker pause, yeah, you don't check it for what? 20 seconds. Every time you check pause, less than what? 10 seconds. So this is a trap. Right answer, number 2. Pauses need to be checked less than 10 minutes, nothing more. Number 5. What do we have? Select or apply. Same thing. Which of the following the nurse should include in the plan of care? A nurse is caring for what? 6-year-old client with headache, photophobia, and nocturnal rigidity. Which of the following the nurse should include? Make your diagnosis with the buzzwords I've underlined. The case is asking you the buzzwords, and what they're asking you to do is which of this action should be included in the plan of care. 6-year-old, headache, photophobia, and nocturnal rigidity, yes, meningitis. What is the most serious aspect of this problem is what? You can have seizures from it, and your ICP can go up due to meningeal irritation and the increase in intracranial pressure. Meninges, most of the organisms involved are involved in what? Droplet precaution, not airborne. ICP, seizures, quiet environment. If you're going to have seizure and your ICP is going to go up, you're not going to eat until we are not 100% sure you're not going to go through this, and you are neurologically stable. Because of this, we don't put a pillow under your head. If you're seizing, you get into trouble. No pillow. Neurological check is perfect. So 2 and 5 are your right answer. You don't need to pick all of them. Pick those that you're confident. That's all you need to do. Number 6. What do we have? What should the nurse expect? Expected finding. 6-year-old buzzword present to the emergency room with what? Acute onset. Buzzword what? Testicular pain. We have a pain issue. Exams reveal elevated transverse left testicles is not in the right position, and then cremasteric reflex is off. Buzzword, 6-year-old, acute onset of testicular pain, is going to lose his limb if you don't do anything. Elevated position of the testicle in the transverse location, and there's absent cremasteric reflex. These are all indicate torsion, testicular torsion. Thus, if you watch my bishop, I talk about pain, losing your limb, and what? High sight. This limb, that's the testicle. If you don't do anything about it, it's going to lose its limb. Blood supply to the testicle is cut. Therefore, we got to act fast. Putting ice pack, we're not going to help. Pain medication is not going to help. Yes, testicular ultrasound will give you an idea what is going on, but what? Time is of essence. This patient needs to have his testicles detoxed in the operating room as soon as possible. Emergency finding, go. If you see this, Amon, who do you see? This is one of the priority function you have to pick because they're going to lose his testicles. Nobody wants to lose their testicles. But unless there's an airway issue, this is always a priority patient. So prepare for surgery. Number 7. A nurse is caring for a client with what? Spina bifida. Which of the following food order the nurse should what? Question. Key concept being analyzed. I hear the word, I've underlined the buzzword, spina bifida, food order, and which one is your question. Whenever you hear spina bifida, think about latex allergy. And therefore, the most important thing that you need to worry about is avoid latex allergy. Banana, avocado, kiwi, chestnut, good source of latex allergy. You should avoid them. So the nurse should question them. Orange is no problem. So she did not need to do that for this. Those need to question 1, 2, 3, 4. She need to question because they are because of this possible latex allergy in this client with spina bifida. You should avoid anything that can also initiate latex allergy. Number 8, selected apply. A nurse is caring for a client with what? Down syndrome. Which of the following the nurse should include in the plan of care during feeding? You see, include. Always underline few words. Down syndrome, you should include in the plan of care feeding. This is a concept. What is one thing you should know about Down syndrome patient that can affect their feeding? Is this word, protruding tongue. They have huge tongue and it's protruding. That cannot feeding. So when you're feeding these people, you got to teach them that. They should have a small, long, straight-handed spoon for feeding. And the food should not just put at the back, but on the side. Push food back and the side of the mouth. And re-give it to them when they trashed out. Because of the size of the tongue, you can't put it on top of the tongue. It's so huge, you will fall off. Because of the size of tongue, you can't see the back. It's affecting you. So this 1 and 3 is the best strategy when you're feeding a client with Down syndrome. Concept to know for your NCLEX. Number 9, select or apply. Which of the following is a potential cause of the murmur? And this is caring for a 6-month-old client with the what? Left to right shunt associated with the murmur. Pay attention to that. Left to right shunt. Okay, which of these can cause that? I've already told you guys we saw one question. Okay, when you see right to left shunt, you're looking for anything that starts with a T. If you don't start with a T, most likely you are not a right to left shunt. Therefore, I will do the right to left shunt. This as a T is gone. This as a T is gone. This as a T is gone. T in the beginning. Therefore, left to right has to be metastatic arteriosus and atrial defect. 2 and 4 are your right answer. Do I make it easy? No, it's just the content level that you got to use to answer this question. Number 10, which of the following the nurse should attribute this behavior to as related to separation anxiety? A bunch of words. A caring nurse noticed that a 9-month-old is now happy, interested in strangers now after the mother went back to work. Which of these indicate portion of the separation anxiety? Which one? Look, keywords, protest. When they protest, mommy leave 9 months, going to work, she's going to cry, the patient is going to cry non-stop, doesn't want to eat, he's just protesting the mommy leaving. Then when they get tired, they become despair, where they regress to their younger age. They don't do anything. They just ignore everybody. They just live in their own way. Don't disturb me. Then when they realize mommy is not coming, they are detached. That means they're happy. They say, hey, you caregiver, take care of me because I have nobody. And they're happy mommy is gone. And that is protest. There's nothing, that's detachment. There's nothing known as anxiety. So this is detachment. Patient is happy and interested in strangers. So it's detached. Number 11. This is another concept. The nurse is teaching new graduate about what? Pincer graph. Which age group show early signs of Pincer graph? The nurse should know. Key concept. 9 months is when you have what? We call it crude Pincer graph. It's not fine. At 10 to 12 months, you have the fine Pincer graph. There's a difference. Crude is not that great. You don't have it truly. By 10 to 12, you should have developed the Pincer grasp with perfection. It's basically a fine one. 8 years old is not ready yet. 9 is the early. 10 and 12, it should be fine. The question is asking for a crude one. So 9 is the best answer. Number 12, what do we have? Select or apply, right? And next is caring for a 4-year-old who died suddenly. Which of the following the action by the nurse need immediate intervention by the child nurse? So immediate intervention. Telling the family at least you have other children is a bad idea, not therapeutic. Planning to attend the funeral, there's no limitation about this is legal. You can go your patient funeral. This is a patient. She want to go. That's fine. She's not doing anything illegal, just paying respect. Remember the family to call the child by the name. Just reminding them to call their family, the kid who's dead by the name. The name that was given to them is acceptable. Provide the family lock of heir of the client. Yes, you're giving the property. This is basically small heir that they can put it in a cremated or whatever. It's okay to give it to the parent. Saying this must be hard for you. This is not a bad therapeutic statement. It's an open statement trying to let them talk. It sounds like that, but you say, oh, this may be hard for you. Can you tell me more? Okay, so this is expected. This is also fine. So 2 and then 5 are okay. Those that need intervention is number 1. So this is the only one that need intervention. This one does not need intervention. I just changed the symbol. So the one that need immediate intervention is number 1. Number 13. A Muslim client just delivered a stillborn 30 minutes ago. What is the next best action? Comfort the mommy, explore custom-related death, provide privacy, and find out the name of the baby. Look, to be sharp, it's always you don't have choice but to do one thing, right? Of course, I'm going to comfort the mommy. Of course, I'm going to provide privacy. Of course, I'm going to find the name of the baby so that I can address it. But guess what? If I don't know what to do, the patient is dead. If you push them in a certain way, if you dress them, if you take something away, if you cut their hair, or whatever you're going to do that is not culturally sensitive or culturally in tune with the Muslim people, it's going to be a problem. So prioritization, you got to be sharp. Find out from the mother. Does the baby need to be at face east or west? Does he need to be prone? Whatever. Just find out from the mother. That's the most prioritized information that you need to find right now in case to make certain arrangement. Number 14. HIV-positive client just delivered a newborn baby. Which of the following is a priority? Look, you have one thing to do, one choice. You want to isolate the baby from the rest of the nursery. It's not infectious. It's not cancer. It's nothing. It's just a standard precaution you give to HIV. In case it's infected, the kid is innocent. Separating them is not contagious. Ask the mother to hold the baby. Of course, they're going to hold the baby. Is that a priority? Think about it. Provide antiviral prophylaxis as soon as possible. Hey, the only thing I'm worried about is the kid having transmission. If I have an ability to give prophylaxis, I'm doing that first, rather than letting the mommy. Mommy holding the baby is still not a priority. It's not going to change the fact that the client has high risk of transmission. So the best thing I would do is antiviral HIV prophylaxis. You should not breastfeed if you live in a developed country. You should what? Bottle feed if you have HIV. But if you live in developing countries, yeah, you can breastfeed with the caveat the kid is getting anti-HIV prophylaxis. Concept, you know. Number 15. What do we have? Select or apply. And this is teaching new graduate about concept of death, for different age group. Which of the following is accurate? Infant, toddler, they have no concept of death. In preschool people, the one thing you should remember every time you hear a preschool is magical. If you have magical, your perception about death is temporary and reversible. So this is wrong. They think it's reversible, not irreversible. School age people, they're developing, so they know that death is reversible. They don't think it's temporary. Adolescent as adult concept view. So the right answer is 1 and 4. Which of the following is accurate? That's 1 and 4. Number 16. This is designed to give you every key milestone you need to know for your NCLEX. And this is teaching new graduate about developmental milestone. Which of the following is accurate? Thus, you have to know this everything in this slide because they keep on coming. So you should master it. Okay. Neat or fine Pincer grab usually occur 10 to 12 months. So that's what you should get it. Crude one begin, that's the earliest sign, is 9 months. Strong palmar grabs is usually 1 month. Then it start to fade away in 3 months. So this is good. They will sit unsupported 8 months. Okay. And then they will walk while holding something. That's cruising is 10 months. Okay. That's what they will do. And then they will sit unsupported, like say 8 months, walk while holding onto something is 10 months. Head control is biggie because parents want their baby to have a head control. If that doesn't happen, they worry. So you have to know 5 to 6 months, they should be able to do that. At 12 months, they will try to build a block made up of 2 blocks, but they will fail. By 15 months, they should be able to achieve that. That's milestone they have to achieve. This is all they need to know. You need to know some of them, but not all of them. But these are key. You got to master them for your NCLEX. In the last one is based on concept of play. The nurse is observing a group of 3-year-old client playing. The nurse will most likely expect to observe the client playing what? 3-year-old. Put him in his right place. There is what? Solitary play, para play, associate, and with corporate. SPAC, right? This solitary play, that means they're playing alone in front of their parents, not in front of their friends. Okay. Parallel play, like a street, parallel to each other. You play here, I play here. But I can see you, I enjoy your company, but we're not playing together. Block building along each other clients. Excellent. Then associate play, that means we're playing. There's no leader. We all playing together, no leader. Everybody is on his way. Everything is organized, disorganized. So same to unorganized, right? Then corporate play, that means there's a leader. He directs you. He make assignment. He assign you assignment, and he will hold you responsible. That's castle building from Lego. It requires organization, and that is corporate play. The right answer is number 4. This is adapting class. Thank you for watching. I know if you look at a subscriber, he's screaming at you. Click it. Take care of yourself. Enjoy. And then all the best of luck. Thank you.